if you could take us behind the curtain a little bit, where did you go and what did you do to put this story together?
Well, in determining what was going on in the air ambulance business, we did a couple of things. Talked to lots of people whose lives had been saved but then ended up deeply in debt because of the bills. We also talked to a nonprofit helicopter ambulance operation in the Dallas area, where they say they never sue the people they've saved. They never put debt collectors on them, and they charge substantially less. And the thing that was most surprising is in sitting down with the big company Air Methods, we learned from them the actual cost is about $10,000 to $12,000, but they bump up the cost because they say they get such low reimbursements from the government for payments for the poor and the elderly.
After you talk to Air Methods, where do you think the system breaks down for this story that's affecting families?
I think it starts with the fact that this industry is not at all regulated in terms of price by the government. They're considered an airline like United or Delta. Under the Airline Deregulation Act, no agency can set their prices or moderate their prices in any way. So they're not the standard healthcare company. They're treated more like an airline. They're free to charge whatever they can get away with, and they do. And that's the first step. Secondly, the insurance companies and Medicare and Medicaid aren't fully reimbursing, and they have their own reasons for that. They think the charges are excessive. But those factors together create a nightmare for consumers who have no choice really when a helicopter is called for them. They end up signing a consent form from Air Methods and from the other companies that does not list what the cost is going to be, but makes them fully and personally responsible.